Good evening, viewers. Hope all of you are doing well, truly well, as we say. Today we are here because it is World Osteoporosis Day, and we are observing it, of course, on our True Wealth Health channel. And we are here with two esteemed faculty with us. I would like to quickly walk you through what we are really going to address here today. But as some of you know, and some of you were new, True Wealth online health channels and it's an initiative of True Wealth Integrative Healthcare, which provides integrative and personalized health and nutrition advice to guide patients and healthy individuals to overcome the health concerns and manage self-help to reach the ultimate goal of holistic health and happiness. True Wealth aims to help you separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts so you can make the right health and nutrition choices. We have two great faculty on the same lines today out here to talk about osteoporosis with you. That's a quick note that this program is for education and spreading awareness. It's not going to be any personalized consultation. You can always reach us out on the numbers and our website. Quickly moving forward, of course, I have put a beauty out there behind Dr. Lotika Purohit because I too believe that she is one very beautiful doctor and one of the most finest diabetologists actually in the city who runs a sugar doctor Medicare, which is such an apt name, and a diabetes care center in Colaba, Mumbai. She's visiting faculty at the Sir J.J. Hospital and honorary consultant at the St. Elizabeth Hospital, Convest Jain Hospital, and the Police Hospital in Mumbai. She's of course she specialized in diabetology from the TN Medical College and has of course done her MBBS from the Grand Medical College. So she's an esteemed member of the RSSDI, which is the Research Society for the Study of Diabetes, which is an esteemed association in the country. In fact, one of the topmost associations in the country. She's very well known for offering excellent patient care, and her extensive knowledge and experience in the field of diabetes and physician practice really makes her one of the finest and sought after diabetologists in Mumbai. With her, of course, we have another sought after faculty who is very respected and renowned spine surgeon in Mumbai. He graduated as a medical doctor from, again, the TN Medical College and is a postgraduate in orthopedic surgery from the Mumbai University. Further, he trained in the subspecialty of spine surgery in Mumbai and multiple centers across the world. He currently practices as a spine surgeon at various hospitals in Mumbai, primarily the Breach Candy and Lilavati Hospital. Like I said, he's been attached to most of the top hospitals in Mumbai. He's a fitness advocate and himself, and is an avid cyclist, trekker, having scaled the Everest Base Camp, Kanchenjunga Base Camp, and submitted the India's highest trekkable peak. So he is also into fitness. So that is another angle we will be addressing out here today. We are also joined in by Dr. Harshal Bam. He is an orthopedic surgeon, specialized again in spine practice. He is DNB ortho, and he has a fellowship in spine. He's been working at the Apollo Hospital, Chembur Halani Healthcare Sion, and he's also an active part of Dr. Abhayanini's team. He practices at the Lilavati Hinduja Healthcare and Peach Candy hospitals as well. So a very warm welcome to all of you here today, and we are really looking forward to getting guidance from you because osteoporosis, as is known, is a silent disease, but yet we know how debilitating it is. I'm not going to really, dwell or waste any more time and really jump in on asking a few questions around understanding the osteoporosis itself. We say that it causes bones to weaken, it causes pain, fractures, etc. So Dr. Purohit, if you would really help us understand itself what osteoporosis is actually. You will have to unmute yourself.
Sorry. Thanks, Rajeshri, for the lovely introduction. The osteoporosis day that's osteoporosis, because sometimes a lot it is missed, I mean, like a silent disease, like even diabetes is a silent disease.
Yes.
So this is usually missed. So the idea of this year's theme is that to make awareness about what is osteoporosis. So basically, osteoporosis is a condition which is characterized by a decrease in the density of the bone, thereby reducing its strength and causing fragile bones. So these people are predisposed to having fractures. A lot of the times, these fractures are probably of the spine, which is what Abhay would be seeing. And
Yes.
but they would probably not come with an acute, fall or something like that. It would be just over a period of time, a chronic backache or something like that, which then when you take an X-ray or do an MRI, you find that they have a fracture and probably needs some intervention. That
Great.
basically.
That's really in simple words for us to understand what osteoporosis really means. But like you said in Dr. Nene's practice, I mean, this silent disease, how does it really do you come to know again? What are there any specific tests that that are available, and which are the ones which are really recommended? Because that's again, there's a BMD and there are several other tests. If we should be doing D3, there's a lot of confusion around that as well. Dr. Nene, that question's for you, because we
Yes.
want to
So
understand your
actually,
perspective.
yes. So osteoporosis does not have any diagnostic tests. That's a very harsh statement. We hang our hat on a number of tests, but the message must go out that there's no single test that can diagnose or even quantify osteoporosis. I'm taking this extra mile and saying this because the DEXA test, which is the bone density test, is a mere shadow of what it should really what it should really show. It's a test that's the only test that gives you the quantity of osteoporosis in numbers, so to say, but it is not sensitive enough to pick up bone from some other tissue like sclerotic bone or a calcium tablet floating in your body. So you can't hang your hat on it. So really speaking, if you see the FRAX criteria, which is open for public, FRAX, which is the WHO website, FRAX criteria, which tells you how to diagnose osteoporosis, and you'll see amongst the 10 questions that are asked, 7 or 8 of them are clinical questions. Are you postmenopausal? Are you a lady? Is there a history of osteoporosis in your family? Have you lost height? Have you had a fracture in the recent past? Have you been experiencing fatigue and inertia? Have you been experiencing back pain, hip pain? Are you on steroids? Are you on any, are you hyperthyroid? Have you been on anti-Parkinson's drugs? Are you on anti-epileptics? So this whole clinical gamut of conditions leads you to a situation. So a typical situation of a postmenopausal lady who's losing weight or lost mass, who may be losing height, is stooping a bit and does complain of fatigue and inertia of movement. She's your candidate who has got osteoporosis, and we just qualify it by using the DEXA test, which is a quantitative analysis of the bone, bone, but it's not sensitive enough for bone. I hope I'm getting across, clearly here. There are some other tests that we do, and people often say that osteoporosis, my calcium levels are normal, so I don't have osteoporosis. Now, this is a complete, fabrication of facts, because calcium is one of the raw materials that contributes to forming bone. And in osteoporosis, there's no lack of raw materials. There's a problem of converting raw materials to bone. So your calcium could be normal, your vitamin D could be normal. It still does not, tell you the osteoporosis. So I think these are some of the myths that we hope to bust in the next, half an hour or 45 minutes of our discussion.
Yes. Yes, definitely. That's exactly why I directed that question to you, in terms of, because it is very confusing for patients out there to understand. But I'm now going to break down the risk factor and the causes question between the both of you. One, of course, because Dr. Purohit is a physician and a woman. So, related to women, what could be the causes? And Dr. Dene, then if you could tell us what are the things that men do wrong for, that they should be careful about. So, Dr. Purohit, if you could explain, because we women are, as it is, because of our hormones, we're subject to so many issues, and this one grapples us more than anything else.
Yeah. So, of course, being a woman puts you at a higher risk for osteoporosis. That's one of the unchangeable risk factors. We unfortunately cannot do much about that. Another thing is age. As you keep aging, and especially around the perimenopausal, is when the risk accelerates, and then it progresses further. Besides that, family history. If you have a history of either a parent having a hip fracture or a sibling having, then you are definitely at a higher risk. People with a small bone size are also at a higher risk. Another thing is the low intake of calcium, especially in our country. The intake of calcium is very low in a lot of people. So this can also lead to a diminished bone density. Besides this, some eating disorders and some inflammatory processes are also there. A lot of people, because especially young girls, they want to look slim and, thin, and they're constantly in
Yeah.
that underweight category. So that's when they, do not have enough of calcium, and then their bones do not grow to be strong, first of all, and thereafter they get depleted very fast. Another thing is gastrointestinal surgery. A lot of people post bariatric surgery or any other gastric surgery, if the intestine or part of the stomach is cut, so then there is a decreased area for absorption of calcium. So that is also one of the causes. Besides this, in women, like I said, around the perimenopausal time, the reduction in the estrogen also contributes to the osteoporosis. The hyperproduction of thyroid hormone, parathyroid hormone, adrenal glands are also contributors of osteoporosis. Sedentary lifestyle, another thing which a lot of people with the sedentary lifestyle, especially a lot of women, though even if at home, they tend to, though they think they're doing a lot of work around the house, but essentially their life is sedentary. So then those are the people also at a high risk for osteoporosis. I think another thing which some women do consume tobacco and alcohol. So those are the things that can be kept within limits. But I think that I would leave for Abhay to add on to.
Yeah, so anatomically also, are we doing, like she said, we are with sedentary lifestyles? I mean, is it, also for men, they are, because
Yes.
professionally they're more exposed. There are professional hazards, or working from home now, or etc. What are those
Yes, sir. Yes, yes.
things that Dr. Nene, you could add actually? What
Mhm.
could be risk factors? Are there any early signs so that we can be aware of them?
So I want to introduce you to the concept of peak bone mass and the bone bank, and I'm quietly sharing
Yes.
this little picture with you because I thought that would be interesting for people to see.
Mhm.
And
Sure.
as you will see that we are like we are when we are young, we
Yes.
are earning money, putting it in our bank, and spending a bit of it, and
Absolutely.
increasing our savings. That's your bone bank, and up to the age of
Yes.
about 35, your bone bank works, and your savings keep on increasing, which means that you keep producing bone and less bone is taken away, less bad bone is taken away, which means overall you're in a plus. So you have accumulation of bone. Now, after, as you can see in this graph, around the figure number 2, that's when your bone bank starts to get into equal balance, equal earning and equal expenditure, which means the line starts to flatten. And then if you see closer to the age of 50 for women, because there's a sudden depletion of estrogen, there's a sudden drop in the increase in the expenditure. So your bone bank remains the same, but the expenses double up, which means more bone gets washed up, new bone is not forming, and hence the graph sharply drops down, as against men where the graph slowly starts to drop down because there's no sudden reduction
Yeah.
in the bone loss. And this is where the issue happens. So if you think that you're going to increase your or decrease your chance of osteoporosis, the best time to do it is when your bone bank is still earning, which is under the age of 35. So if you
Yes.
can invest in good diet, specifically alluding to good proteins, calcium, vitamin D, vitamin C, the rarer minerals, which maybe Dr. Purohit can talk to us about, but correct diet, more importantly, correct weight bearing exercises, which means you got to be loading your bones. There's a demand supply. Remember, your bone is a living tissue. So if there's no demand, there's no supply. It's commonly seen that a lot of Indian women, I'm sorry for taking that, making that stand, but don't load up or don't do loaded activities for the forearms.
Yes.
And hence, if you see across the board, the DEXA scores of Indian women are far lower than their average bone density score. So you got to do some loaded activities for your hands. So the village folk, they get strong bones because they're doing manual labor during the early years. And our guys, all of us who don't build up our bone bank, we have to live off a very deficient saving, so to say. And that's where we fall short. Now, at the bottom of this is something that's out of your control, and that's your genetic predisposition. So all of us come with a genetic predisposition. So if your mom has osteoporosis, which means she's a full-blown osteoporotic at 60, it's almost a given because it's a dominant gene. It's almost a given that the girl child, and a high chance that the boy child also, but a much bigger chance for the girl child, is going to be osteoporotic. So you struggle as you may, but you're still going to have to fight the demons.
Sure. I think that graph which you started off was perfect, and then adolescent is actually the age where it's observed as a research that is the time when the children are actually most malnutrition, because they are not focusing on nutrition, focusing on their careers, focusing on so many other things. But that's the time where we have to actually make and start building the bank, and that's where we have to actually focus on. So the problem really is not in the adults; it's actually when we are children. But having said that, you brought up the point of fitness and nutrition, which was chronologically going to be the next thing I was going to come to too. So, but when you said nutrition and you said proteins, but while you say that itself, before we actually understand its importance, it's already gone into a controversy at the same time. What type of proteins to be eaten, if vitamin D and calcium really needs to be taken, how much should be the quantity. So there are several questions around this, again, myths, and as a nutrition expert, I also am aware that these issues are so much there. But Dr. Purohit, on that point, when it comes to nutrition, what do you think? I mean, what are these factors? Because we predominantly know that protein is consumed at such a lower percentage in our country, and when it comes to women, we probably are just eating out what is left over from our children's plate, or left over after what the family has eaten. So what happens to what should be actually done?
Yes. Actually, you said what you said is right. A lot of times, especially as women, although we are the ones who plan the meals, but usually the meal planning is done depending on what the child likes, or what the husband likes, or what the in-laws like. So so it is not
Mhm.
usually our choice in planning the meal. But proteins something which is very important,
Yeah.
but however, it is lacking in our Indian diet. It can be supplemented by having a lot more of pulses, not just a non-vegetarian source of protein, but all legumes, seeds, nuts also can add to the protein consumption. Besides this, we need to have a lot more of calcium in our diet. The calcium consumption is much less in our diet. We need to have a lot more. Milk, of course, is a little controversial. A lot of people advocate
Yes.
drinking milk, but a lot of people say no. But even then,
Oh, we can't hear you very well. Dr. Purohit, your voice is cracking. No, you were still muted.
While she's coming along, I'll
Yes.
butt in and just
yeah,
fill in for. Yeah, there she is. I think you're
yeah.
muted, Lautika. Yeah.
Yeah.
Now it's better. Yeah.
Yeah.
Okay.
That's perfect.
So
Yeah.
basically, as I said, the consumption of protein is very less. We see a lot of people with malnutrition due to the lack of protein consumption, which should be increased. There should be more consumption of dal. A lot of young girls, especially, think that eating dals or pulses is fattening, which is wrong. But that is the
Yeah.
time, like Dr. Nene said, to build up the protein, build up the calcium bank, the osteoporosis.
Yeah.
To see that you have good tissue. Another thing that is good is green leafy vegetables, or if they eat fish, or tofu, or even paneer, whatever those are the things that should be added to the diet. Besides that, vitamin D, of course, is very important. A lot of times when we say vitamin D, people say, oh, I should go out and maybe sit in the sun. I say that's not enough, because in these days there's so much of pollution, that's not going to help. You just
Yeah.
require to supplement it along with whatever else you are eating. The best would be to take a vitamin D supplement adequately. You would require about 800 IU per day,
Right.
definitely. And that should also contribute. Besides that, of course, we need a lot of other micronutrients,
Yes.
magnesium, zinc, selenium, all these other things are also contribute.
Yes, yes. So I think she perfectly addressed what all can be eaten. But Dr. Nene, again, there is a myth, really, that people think when you say bone, that means it's calcium. We're still in those old calcium tablet days where bone is just calcium. So is bone really calcium alone? What do we really need to do around the bone health? What are the nutrients you think are critical around the
So
bone
again,
health
at
as
the
well?
cost of hogging footage, I'm going to just quickly share a screen,
Sure.
because it's a
Yes.
very very cool cool depiction of the
Yes.
structure of the normal bone. If you see the normal bone, it's
Perfect.
like a
Yeah.
building which has got beams and columns,
Yes.
right? So those are the
Yes.
columns and these are the beams, and these are made out of bone, which is protein collagen. It's got
Right.
nothing to do with calcium. It's like your skin or your muscle or your tendon. So it's a tissue that's inherently built, and then mineral gets deposited on it. So just like a building is being built,
So
there's a
true.
framework of columns and beams, and then you pack in the plaster and the cement, etc., which is the mineral. Now there's a condition called osteomalacia where you have a deficiency of minerals, and that is the condition where you get a reduction in the quantity of bone, which means that your bones and columns are adequate, but the amount of mineral deposits on it are low. And this is seen in younger people who are still in the bone producing age. You
Right.
just have to fill in the minerals and you're set.
Yeah.
But osteoporosis is much like this, where the number of beams and columns also are less, and
Yeah.
so is the amount of mineral, and that gives rise to not only a qualitative, but not only a quantitative deficiency in the
Correct.
bone,
Correct.
but also a qualitative deficiency in the bone. And calcium and maybe vitamin D merely contributes to the mineral content of the bone, and not really the columns and the beams, which are a biological process of generating bone. And that's something that people need to get into their heads when they say that I'm eating calcium, but yet I've got I can't get osteoporosis. My calcium, I'm eating 2 calciums a day. That's not
Yeah.
possible.
Yeah, people also, I mean, there were of course a couple of questions around that also, that people do not realize that it's really a light tissue inside our body, and it also keeps having a wear and tear. So that process really of the osteoblast and osteocytes is also really ununderstood. If anyone of you want to throw some light on it, because it is really about the formation and the how much we are able to consume in terms of these minerals and proteins. So if one of you wants to explain that, the bone cells really, which people fail to understand.
So, Lotika, I'll
No,
take a bite at it.
yeah, sure, you can.
Yeah.
So,
Well,
again,
well, it chronologically looked like your slide, the next slide on your deck, because it
so
was so good to understand
Yeah.
that. Yeah.
So basically, osteoblasts are the bone-forming cells which actually form bone. So remember, bone is a living tissue like hair. It grows
Yes.
and then you cut it, and then it grows and you cut it. The redundant bone is removed and new bone is put in, and that's how the quality of the bone is maintained.
Yes.
Now, this process, like we discussed before, happens until the age of 35 or even 40. In this, the osteoblasts are forming bone, and the osteoclasts are taking away the redundant or the bone that has gone bad, and a new bone is being deposited. Now, the level of the osteoblast is much higher in the growing skeleton, and it starts to plateau down in an adult skeleton, and it almost disappears in the postmenopausal skeleton and in the men above 70, while the percentage of osteocytes remains constant, except in postmenopausal women, where the percentage of osteocytes also, which osteoclasts, which actually eat away dead bone, goes away. And hence, coming back to the same thing, that osteoporosis is not only a quantitative deficiency, it's a qualitative deficiency in your bone also. Do you want to add anything to this, Lotika?
No. Yeah. Yeah.
Yeah,
If you
I think you summarized it perfectly well, because we don't
We're losing you on some.
Yeah. Yes. No, your sound is again. We can't hear you. So
Where protein fits in. No, protein is a
yeah. Yes.
collagen that really
So
forms the
Yeah,
beams and the columns. And
yeah.
protein
yeah, yeah,
deficiency is rife in our country because our Indian diet is
Yes.
deficient in protein. All of us
Yes.
true,
need 1 gram
true.
per kilo. Dr. Purohit will tell us in a much more, in a better way. But I
Yeah.
just want to give you a sample that you feel that if you've taken one bowl of dal a day or sick, 1 bowl of dal gives you 6 grams of protein. And if you're 50 kilos, which most of us are not, we are in the higher 70s, you need
Yeah,
50 grams of protein.
Correct.
So how many cups of
true,
dal does that match up to, and what is it
Yeah.
going to
true,
do
true.
to your
Yes.
digestive
Yes.
system? So Lotika,
Yeah.
if you're there, can you
Yeah,
take
yeah.
that lead?
Yeah, definitely. The consumption of protein is very, very less in our country. And yes, of course, osteoporosis is one of the probably contributing, what occurs due to that lack of protein. Besides, of course, so many other things. Um, we somehow, even 1 cup of dal is also, you're saying, is too much. A lot of times that dal is so thin that there's maybe 3 grams of protein in it, if at all. And a lot of times people think that dal is fattening, so they even avoid it altogether. So it's usually just vegetable
Yeah.
and roti, and there's hardly any protein in the diet, which
So
is unfortunate.
So why I really brought this up, because I know osteocytes and all this is very complex, but this is what people really read up on the
Okay.
Google, and I'm sure they come to you or they misunderstand all of it. There is also a component of really remodeling, which is also ununderstood. I don't know if any of you want to throw some light on that, but I wanted to share to the effect where Dr. Nene was talking about the proteins and what are the different types of, these are the different types of things that you can eat, and see the amount of protein you can get per serve is 25 to 30 grams of protein when you're trying to eat non-vegetarian food like chicken and fish. And if you're having milk and dairy, you can get about 10 to 15 grams. And of course then follows paneer and egg and beans and nuts. So we have a lot of mix that we should be eating. And the point which you were trying to bring out, Dr. Nene, again, was that amount of protein and the quantity and the quality of the bone and the protein again matters. So what are the type of amino acids which the protein breaks down into is very important, just from the fact that, of course, how much of protein you're eating. So it is very critical that we eat mix of proteins, so we get isoleucine, leucine, valine, glutamine, arginine. These are very important amino acids that we can get, and they have different roles, giving strength to the bone. They're also right now needed for the immune system, which everyone is right now focusing on. So I just wanted to show that. But another myth, because wanted to bring that question up again, because remodeling is another something which is very important when it comes to not just producing the cells, but that is where I think nutrition plays a big role. If any of you wants to comment on that, otherwise I can actually go on to the
We
next
spoke
question.
about it.
Yes, yes,
Removal and
yes, yes,
Yeah,
deposition of bone,
yes,
which
yes.
typically disappears in all of us who are on this platform. So you got to forget about remodeling in us, and we got to worry about trying to retain what we have.
Well, and then then the chronological next question really comes to fitness, because as we are bad at nutrition also when it comes to physical activity. And
true.
does really physical activity help both prevention and treatment? What's your take onto it, Dr. Purohit? Maybe you can take the question first, and then we can
Yeah.
go to.
So exercise is very important for strong bones, and is very important. A lot of
Oh,
they need to exercise. They say that, oh, especially a woman who is working, and in today's time, working from home and working at home, will say that I really don't have time for exercise. And but however, they still need to at least start walking. That's the best that they can do. uh, they need to also do some stretches, preferably some supervised strength training 3 times a week needs to be done, maybe lifting light weights, or Also, another thing that is good is yoga and Tai Chi, because it gives them a little bit better balance. As you grow older, the chances of falling are much higher. So, if they have a better balance, if they have done some yoga and Tai Chi, then that helps at least, so they are not falling and breaking bones. So, essentially, that's what is there. They can walk up and down the stairs, skipping if they can, otherwise cycling. The other, swimming, cycling, usually do not add to their weight bearing exercises. um, so I think the best, of course, is walking, and they need to do something for the upper body too.
That was very neatly explained, especially to women who don't even probably have sports shoes at home. So Dr. Nene, for women like us who probably don't even have sports shoes, or we forget about wearing them and doing anything, you are a god for us. So if but what is the advice you give to your both patients, men and women? What is really the advice you give to them?
So I must correct you here, actually, on this, because the gods of running are women. If you go out there on Marine Drive on a Sunday, the
Okay.
the ladies are killing the miles and the men are just struggling behind them. They're
Oh,
really the
wow.
best and the most fittest runners on the road. So things have dramatically changed. I can tell you
Changed.
that.
Yeah.
But coming to the point of exercise, I would again bring to focus a terminology called sarcopenia. So
Mhm.
people say osteoporosis, my bones are weak, but osteoporosis goes hand in hand with muscle loss, and that's called sarcopenia, because they are
Yeah.
practically the same tissue. And sarcopenia hurts you far more sometimes than the bone loss, because
Definitely.
bones hurt you only when they break finally, or when they have insufficiency cracks. But muscles can hurt you in multiple ways. So just pretty much like Dr. Purohit nailed it. Actually, there are three things that you need to work on as you get older. We call it fitness after 40. One is resistance training. So you got to challenge your muscles with resistance. So resistance bands for the hands, walking
Yeah.
upstairs, running, skipping. Something that pushes the muscles into regenerating more muscle. Because at the bottom, there's also another secret that very few people know, is that the muscle is the only musculoskeletal tissue that can regenerate till you're alive. So even at 90, you can start developing muscles. None of the other musculoskeletal tissues regenerate. Bones, joints, cartilage, tendons, nothing regenerates. Once gone is gone. So you try to rely on your muscles more and more. And the three things that Dr. Purohit nailed, actually, one was his resistance training for the upper
Yes.
limb and the lower limb and the torso. The other is endurance training, which is
Right.
building up your red fibers, which help you, stay in the vertical posture for the better part of the day. And that comes by cardio exercises. And the third is balance training, because balance is an inherent part of fall prevention. And if you have a good balance, the chances of you falling and hence then breaking your bones becomes less. And balance is another thing that gets lost as you grow older because of degeneration of your neuromuscular junctions. And hence, some kind of a balance exercise is important. So, to sum it up, I think walking, stroke, running as one category,
Right.
resistance bands versus body weight exercises like push-ups or light dumbbells, PT stuff that is taught to you when you're kids, using 1 or 2 kilo dumbbells, and some balance forms like Tai Chi, or standing on one leg, Shirshasana, anything you like to do. I think kind of rolls everything together, and that's the least minimum that you can do to yourself.
So I'm glad that you said that, even that muscle is a tissue which can regenerate till you're alive, and even at 90 you can do that, because there are people out there, and I'm sure you have a lot of patients who resist doing physical activity, because that's another very big issue. People are living longer, but at the same time they're not even once their back is starts aching and the pain is consistent, they stop doing any physical activity. So any
Yeah.
more advice that you could actually give to them? I mean, both of you, whoever wants to.
I think what they should do is, those who are sedentary, who have not
Yeah.
done any exercise at all, should
Yeah.
start with maybe 10 minutes walk.
Mm-hmm. You're muted again. Yeah. Yeah, we can hear you now. No.
what Lotika is saying is the easiest way to get your ass off the couch is just start walks, and that can be done in
Yes,
your
yes,
comfort of the house. You can do
yes,
it,
of course.
in
A
The
the
better
easiest
way to
thing
say
is,
it.
I always tell my patients, I said, can you walk for 5 minutes? They say, okay. I said, okay, then do it 5 minutes, 3 to 4 times a day to
Yeah.
start to at least get moving that way. And then slowly, slowly increase it. And then, of course, the resistance bands, use that to increase your muscle resistance. And along with that, some balance exercises also should be there. Another thing which is easy to do is you can go up one floor up, or even start with half floor down, half floor up, which also is, baby steps to start fitness. So, yeah.
Yeah. The other thing which, of course, Dr. Nene showed it in his that perfect graph that, women really, we see that after 40, women actually have more deterioration and bone density actually goes further, escalates down faster in women. So, what is that specific advice you give to your patients when it is, when they're near to menopause?
So for me, I would screen all perimenopausal women for
Okay.
osteoporosis, going through a detailed history and doing the DEXA test, doing calcium, vitamin D, and PTH levels in the blood, and get a sense of where they stand. And sometimes preemptively start medicines. Now here is the wall that we physicians hit, and that is that the net amount of pharmacological
Mhm.
solutions for osteoporosis are limited to about 18 or 20 years. So we cannot treat someone for longer than, say, the upper limit of 20 years. And that's where the problem starts. For a lady, osteoporosis starts at the age of 50, which means at the age of 70, we've run out of stocks. And that's where trying to, pull on and introduce medications as late as possible and try to rely on natural kind of fallbacks becomes the name of the game, and that's where prevention becomes the best
Yes.
form of treatment for osteoporosis, because once you have it, you're kind of between the devil and the deep sea. Okay, should I take medicine and then bust my supplies, or should I wait and then let the osteoporosis drop down? So the biggest advice we say is that if you have kids, especially girl children, just tell them to get stuff on the line and build their bone banks, and we spend time actually talking to them about what the bone bank is and how they can make their savings count
Yeah.
for them as they grow older.
On this point, I think I just want to add a couple of things because it's around nutrition. Two things I think people miss, like one, as Dr. Purohit said, good amount of vitamins and minerals. So vitamins are also essential because if with not them, the uptake of nutrients doesn't happen. The second thing again, which I've observed is enzymes is something which we don't consume in our foods very well. Raw foods is something which is not a part of our regimen again. So which is why I think the enzymes are lower, and no matter how much we eat right also, if you're not able to uptake, and this becomes more graver when you get older, because that is when your pancreas is going to slow down, your enzymes are going to lower further the secretion of enzymes. So I think in the older patients, probably a good enzyme supplementation, or maybe also at least eating right foods, having the enzymes is very essential. So the couple of things from my end on nutrition, but really then going back to taking Dr. Purohit's input also, because when it comes to menopause, what is that you're primarily telling women?
Yeah, of course. What I do is that, of course, they should be evaluated to see what is the exact
Oops, again, your voice is gone again. No. Yeah.
Hello? Yeah.
Yes.
Is it better? Yeah.
Yeah.
So basically, first would be evaluation. Where exactly do they stand? And thereafter,
No, again, we can't hear you. Do you want to log out and log in again? Maybe it'll get better.
So
Yeah.
basically,
So I
what we
think
want to tell them is the red flags. So, a lady who's for between 45 and 50, I'm going
yes.
to tell her to watch, measure her weight, measure the
Mm-hmm.
mass, so they can actually see the
Yeah.
size of the sleeve or the fitting of the sleeve,
Correct.
You ask their
Yes.
kin to look at the stoop. If they're starting to develop a stoop, we call that a Dowager's
Correct.
hump. You can actually
Correct.
ask them to measure their height. You can
Yeah.
ask them about bone pains and about, like I mentioned, inertia of work. So you have a party in the house and you can easily handle all the guests, but now by the end of that, you're flat out for the next day. So that's inertia, and that's inability to sustain physical loading. So these are the markers that you go through, and if indeed there is any of this, you obviously subject them, and in fact subjecting them to tests becomes a preempt, like you don't even wait for the red flags to come up, because as has been said many times over, it's a silent disease, and by the time the symptoms come, you've already missed the bus. So you got to
Yeah.
preempt
Yeah.
it by figuring out the osteoporosis status and start treating it before it actually hits you.
Right. So, so really, with you having you out here as a spine surgeon, really, I mean, when does this problem get graver? Because, ultimately, this people. A lot of people come to know itself when they start having fractures, and how is it really affecting our spine so much? And does any surgical intervention is any of a surgical intervention is it needed for our
So
patients?
without exaggerating, I see two osteoporotic fractures of the spine every clinic, and
Okay.
this is not an exaggeration. So what happens is that none of us know that we have osteoporosis because of the reasons that we mentioned,
Yeah.
and the bone keeps getting eaten up from within until it implodes. It's like an old building which for no reason a wall breaks down, that kind of an implosion. Well, it is a source of disability, but it's not of the nature of other spinal fractures in younger healthier bones, which we call burst fractures, which like smashing a brick with a hammer, and it breaks into pieces, and the surgeon has to go and put everything together. So as far as surgery is concerned, it's a very, very low rate of surgical problems in these fractures. But more than that, it gives rise to almost lifelong disability, about a month or month and a half of very severe pain, because you can imagine it's your central column that is now
Yeah.
disintegrated. And after that, a permanent, soft tissue weakness or a ligament weakness in the back, a stoop in the back, a bend that happens in the back, and much more importantly, it increases the chance of another insufficiency fracture in your body by almost threefold. And if that fracture is in the wrist, so the common insufficiency fractures happen in all the weight bearing areas. So the spine, the hips, the wrist, and the shoulders. And
Correct.
almost all other areas need surgical intervention. And remember, surgery, osteoporosis is a graveyard for surgeons, like they say. That
Yeah.
if I have to do surgeries in an osteoporotic spine, I'm really fighting against bones that don't want to hold the screw that I want to put in. So it becomes a huge challenge when this osteoporotic fracture, in the rare, I would say less than 5% of people, actually affects the nerve of the spine. And a spinal fracture causing a nerve compression leading to paraplegia is
Yeah.
a disaster situation. Once again, is devil under deep sea, but you have to go in, decompress the nerve, strengthen the back. But at the end of the day, like I said, it's a battle. That's an uphill battle.
Yeah. So I think viewers, you should take note of this because we really don't want to go
Yeah.
get to these serious conditions. And going back to you, Dr. Purohit, you're totally audible now.
Yeah.
Going back to the question of menopause, and of course, what are the different drug treatments that are available, and how effective they are. Whatever little bit the viewers can know about it, because that's again something which people these days look up over the internet, and they have their views, but we need to get the right understanding to them.
So basically, we don't have too many medications to choose from, but yes, we do have a few medications. Currently, the most effective are the anti-resorptive agents, which probably would be, to inhibit the removal of the bone from the remove of the bone resorption, and thus tipping the balance in the favor of bone rebuilding and increasing the bone density. HRT is also available. Bisphosphonates are available, and besides, of course, food, the calcium, iron supplements, vitamins. Uh, Zolendronate is one of the medications that
Yes.
we have used extensively earlier. Then the oral Fosamax, as it was called, alendronate, is
Yes.
also used. Uh, Calcitonin, teriparatide is also something which is used in a lot of times we have used used it in, like how Dr. Nine said, the post-fracture ones, wherein you want to promote the healing. Uh, Besides that, hormone therapy is also something that is considered. So basically, the choice in making the medication is depending on what are the other symptoms. If it is a patient who's a postmenopausal woman, who's also having some hot flushes and vaginal dryness, then HRT would be the treatment of choice. If you want to prevent and treat osteoporosis, then bisphosphonates are something that you would use. But of course, you have to be careful, because a lot of times these cause some esophageal irritation, ulceration, and dysphagia also. Um, then patients who have GERD or heartburn, in them it is further irritating. So they may not respond very well, or they might discontinue the treatment. Calcitonin is something which is a weak anti-resorptive medication also, for patients who would not take anything else. Estrogen replacement is something also which we can consider. So it really depends on what else are we treating besides the osteoporosis. That would help us choose what medication to use.
That's very complex information. Put it up very easily for us to really understand. So people have to understand that do not go and Google. Do understand, because there are so many
True.
parameters that have to be understood before any
That's
treatment
right.
is sort of
That's right.
sort of given up. Any inputs from you, Dr. Nene?
So basically, there are three categories of drugs that can be used. And when you hear me out, you'll understand why it's an uphill battle to treat osteoporosis, and prevention is much better. So
Yeah.
the first and second category, like again, Dr. Purohit very rightly said, are the anti-resorptives, which means they stop the rate of bone loss. So they're really not solving your problem. They're just reducing the rate at which you're going down. And that's the most used drug that we have. So you can imagine the plight where we stand. Like
Yeah.
if you're at -5, we can help you slow down, going to -6. The
Yeah.
only one category of drug, as again Dr. Purohit rightly said, is the teriparatide, which is a game changer in osteoporosis. It can actually U-turn and create new bone. The
Yeah.
controversy here is that that drug is allowed only for 2.5 years of your life, and hence
Yes.
that can bail you out for a very short time, and that's
Yes.
where we are kind of stuck. The third category is hormonal treatment, and estrogen replacement seems like a logical answer that, okay, well, if you're getting postmenopausal osteoporosis because your estrogen is stopped, I'll give you estrogen externally and you should be fine. But that's not how it works, because the estrogen stops for a reason, because the female organs in the body are accept the onslaught of estrogen only up to a certain time. After that, if estrogen continues to get produced, or if those organs, specifically the cervix, the uterus, the breast tissue, if it keeps getting exposed to estrogen after a certain age, approximately 45, 50 years of age, the chance of cancer significantly rises. So, in fact, the trial that was made to check on estrogen replacement therapy as a treatment of osteoporosis for postmenopausal women had to be
Yeah.
discontinued because of a disproportionately high number of cancers that happened in the
Correct.
ladies who were taking estrogen beyond 50. So that becomes a null and void option for the standard postmenopausal osteoporosis.
True.
And that's where we are kind of stuck. We are, we are caught with our
Yeah.
knickers around our ankles, if you may.
Wow.
Yeah.
So so the next question, really, I want to again reiterate. I know we have spoken a lot about prevention, but a lot of people think that when we take these drugs, then we don't need to look at any sort of nutrition going on continuously or fitness. They think that medication is good enough. So medication plus nutrition. So when we are talking about the resorption therapies as well, unless we are eating the right things, it's still going to defeat the purpose. So if you could reiterate, any of you, because that is essential. People need to understand that you need to eat right. It's not an option.
True, true. Yeah, that's very important. The right amount of protein, the right amount of calcium, vitamin D, and the other
Yes.
minerals are very important. Besides this, exercise is also very important to see that you have a good bone bank to start with. And the exercise should start not just when you develop osteoporosis, but much earlier in life. It should be a part of regular life.
And so Dr. Nene, when we resort to supplementation, your views on it, because again, there are mixed views. If supplement should be taken or not. At times, there are patients who actually decide to just disregard some of them. They are like they have too much of medication to be taken, so they can actually keep the supplements aside. What would you say to them? Because it's supplements required, how required they are, and what is the caveat you would give to them?
So I lost you there a bit, but I'm going to tell you about the three things that I feel very strongly about, and that's supplementation of calcium, proteins, and vitamin D. So the myth
Yeah.
is that the first myth is that I have kidney stones, so I can't take calcium, or the articles that flash out in the print media saying that excessive calcium can lead to calcification of arteries and calcification in the various tissues of the body. Now that's a myth, because calcification will happen if there's a problem with that organ, and there's no dearth of calcium in your body, and that calcium will be sourced out from the bone and the stone will still happen. So taking calcium supplements does not lead to calcium stones for the larger population. And the requirement of calcium is after menopause goes to almost 1500 milligrams a day, which is
Yeah.
not coming from your diet. And you got to, so at least some supplement of calcium is needed. And if you have a calcification problem, you treat that separately. Don't overtake
Yeah.
calcium. Don't take like 4 tablets of 500 milligrams a day, but take your basic upgrade. The
Yeah.
second, again, Dr. Purohit had mentioned that sometime earlier, was about vitamin D. And people say that I go out in the sun, so I'll get vitamin D. Now the myth here is that
Yes.
morning sun does not give you vitamin D. It has
Yeah.
to be vertical direct sunlight, which all Indians need, because you will turn darker than you already are, and you will
Yeah.
sweat like like anyone, like you soak up. So most of us go out in the sun in the morning, but very few of us go out in the sun in the mid afternoon.
Yeah.
Also, there are two other factors. The dark skin needs far more sunlight,
Yes.
more than the traditional 45 minutes of sunlight exposure in a half sleeve shirt and shorts. And in Bombay city, like Dr. Purohit rightly said, pollution leads to a smog layer, which filters ultraviolet radiation. And hence, even if you check all the boxes, you still don't get your pound of flesh in terms of vitamin D coming from sunlight. So you need supplements there. And proteins, we already discussed that no matter what you do,
Yes.
you're falling short
Yes.
of protein. So I think these are the three things that you got to always be aware of.
Really? So, so we've really covered everything in entirety when it comes to just to add to the fun. I just posted to exactly your point of vitamin D. I posted a image today with a skeleton actually lying in the sun and with a margarita aside. So trying to hit that you'll get the margarita, but not necessarily that you're going to get the vitamin D and your bones are going to get good overnight. But couple of things again which Dr. Purohit said towards and we're coming to the end of the session, is she said magnesium is also extremely important, and when you're saying calcification, I think vitamin K27 also has a good role when actually trying to curb the calcification. So would you like to add anything on the other minerals, if there are any pointers, Dr. Nene?
I think my partner here is far better
Okay.
equipped at answering.
Yes. Yes, that's why she is really here to give us that side of the knowledge. Because and Dr. Purohit, would you add anything towards the end? Would you like to give any important takeaways for, especially for the women, and also for the older population and the younger population, what they should be
Yeah.
doing today on the World Osteoporosis Day, really?
So we have, because of the longevity, osteoporosis is something that we have to deal with. It will come along with the increasing age. Osteoporosis will be a part of our life. It's just how we can delay it by eating well, seeing that we eat a protein rich, calcium rich diet with vitamin D and
Whoops, your voice is gone again. Yeah. No, we can't hear you. No. Yeah, yeah,
yeah.
yeah.
If we are able to eat that much amount of protein and calcium, then we need to supplement it. But we should have a regular about 1,000 milligrams of calcium as you grow along. 200 for a pregnant lady, maybe about 1,500 for a perimenopause person is the recommended intake. If you are not able to eat it from your diet, you should supplement it. Vitamin D supplement is something also which you should have. And besides that, what is important is exercise. Regular exercise is very important. Some amount of cardio, some amount of strength training, and some amount of balancing. These are the three components which are very important. So that would probably delay osteoporosis and the fractures that are associated with it.
Dr. Nene, what are your takeaways
Well,
for
adding to
especially
this,
people
I
take?
think screening, like be aware, your eyes will only see what your mind knows. So screen yourself in terms of the physical symptoms that we spoke about: weight loss, loss of mass, tiredness, stoop, loss of height, history of fractures in the family. Look at the female lineage in your family and be very vigilant. And once you screen, you can take cognizance and treat before the fractures actually start to happen.
Well, these were an hour long of excellent inputs from both you experts. And, I don't know whether viewers understand, but you both are from very proudly from Mumbai, and one of the most acclaimed part of Mumbai, where you have such great skills and experience that you brought to the table today from your entire day-to-day thing that you see. It's for you, it's like day in day out. For us to understand this complex subject in a very easier way and get the authentic inputs, I think that was most vital. The fact that you both took out so much of time, because it's no more that we are in a lockdown. We are juggling both the lockdown issues, and at the same time we have gotten back to our full-fledged routine. So thank you for taking that much of time out. And I would like to thank the viewers for being with us, encouraging us. In fact, I have done a couple of programs with both of you earlier. And, interestingly, Dr. Nene, we did a women program with Dr. Purohit, which reached about 20,000 plus people. So, she's already known in our network so well. And it's been also a pleasure with you doing the fitness program, which with, of course, outreach thousands again. The program had reached around 8 to 10,000 people through 6 different platforms. So we are again on 6 different platforms today. We did have a few technical issues to begin with, but we are happy that we are reaching this program to maximum number of people. And I thank you again, and we'll hopefully be back with more interesting pointers from you whenever you would like to come up on our platform as well. Thank you again. We say a bye for this session, and
Cheers.
I'm just
Thank
going to
you.
play
Thank
a.
you.
Thank you, Dr.
Uh,
Purohit.
I'm
Thank you, Dr. Lene.
I'm just going to
Thank
play
you,
the
Raj.
promo of RSD Energia, who they continuously sort of support us, putting all the technical things forward. Mr. Mahesh Darade is leading the team, trying to help us in and out, sending flyers and information across the platforms for us. So thank you to they and their team, basically.